Okay, so the first one, let's go through the clinical side, or the clinical psychologist, or in Malaysia we also call them as psychologists. So these people, you're gonna meet them at the clinic or hospital. Usually you're going to meet them there, or in the private sector you're going to see them, and usually they are the one that will run you the psychological tests. So there are a wide range of psychological tests that you will learn in your like your syllabus in your degree years. And to be a clinical psychologist, I must say that you have to complete the 4-year degree of psychology. Alright, and then after that you need to continue your postgrad studies, doing master in clinical psychologist. Only then you can register yourself with the organization, like to get the license to practice yourself as the clinical psychologist. So the first one, you need to run the psychological test, and then the second one, you really need to master the DSM-5. So what is this DSM-5? Okay, so this is the book, or I would say the manual book used for the clinical psychologist, to get to know what are the mental health disorders faced by the the clients or the patients that come to them. So this is like, I would say, like, this is like, what do we call that, macam kamus Dewan Bahasa, something like that lah kan. Okay, so they really need to like put this thing in the pocket and always to like memorize everything, just like the doctor at the hospitals, right? They know already those kind of weird name of the apa tu penyakit and everything. So same goes to this SM5, which is really cool. Okay, and the last one, of course, the clinical psychologists are expected to be an analytical thinker. Means that they really need to like do deep analysis on what are the things faced by the patient. I must tell you, when there is someone or individual who is suffering with the mental health disorders, they are actually having lots of things going on in their mind, and they just don't know how to like express it, or they don't know how to like tell the people that they want to liaise to, or the people that they want to seek help from too. So the clinical psychologists, they play a big role in this field. They really need to know how to do the correct screening test, and like somehow interpret the data that they have. And they will actually liaise with the psychiatrist, because once they got all the data, all the like the information in regards to the test, they execute, they need to give that test and the results to the psychiatrist, for the psychiatrist to confirm and give diagnosis to the patients. And only then the patients will be prescribed with the medicine and everything. So the clinical psych play a really big role in like determining and also help and assisting the doctors, the psychiatrists, on what are the things that we should give to this kind of patients, something like that.